So we have learned that the kidney tubules are linked to an abandonment, to feeling abandoned. Well, abandonment can also be experienced as rejection, particularly as sexual rejection. If a conflict has a sexual content, then other biological programs run their course. In women, it's the cervix. In men, it's the prostate. And we're going to start with the ladies. See, now we can already talk German medicine. Hey, this is why we went through the germ layers, so we can appreciate the scientific value of the work. Let's first look at the organ. The cervix is the passageway to the uterus. The lining of the cervix derives from the ectoderm, the youngest germ layer, and is therefore controlled from the youngest part of the brain, which is the cerebral cortex. To be precise, the lining of the cervix is controlled from the left temporal lobe just above the left ear. The conflict linked to the cervix is a sexual conflict of not being able to mate. In nature, such a conflict occurs if mating is unexpectedly interrupted or doesn't take place for one or the other reason. If this is the case, the cervix instantly starts to ulcerate, causing tissue loss. The biological purpose of the tissue loss is to widen the cervix, so when mating finally takes place, more sperm can reach the uterus to enhance the chance of conception. For us women, this conflict translates this sexual mating conflict into sexual rejection, sexual frustration, feeling sexually turned down or unwanted. A woman can suffer such a conflict if she finds out that her husband is interested in other females, that he's sexually attracted to another woman. Just the suspicion that he might sleep with another woman can already trigger the conflict. In general, a sexual conflict for a female in this case can be related to any distress in relation to sexuality. This includes unwanted sex. This includes unwanted sexual practices, sexual harassment, sexual abuse, rape, any shocks in relation with pornography, for example. So young girls can experience such a conflict at a very young age. So let's see what happens. The moment the conflict occurs, the conflict impacts in the area of the brain that controls the cervix, and this moment the cells in the cervix start to ulcerate, or the lining starts to ulcerate, causing tissue loss. During the conflict active phase, there are no symptoms, so the woman is not going to notice anything. Okay, she's conflict active. Keep in mind, she's preoccupied with the conflict. What's going on here? In this case, as far as the sexual conflict is concerned, she can't sleep. She has cold hands. She is in a state of stress. Physically, she doesn't notice anything. This changes the moment the conflict is resolved. The moment the conflict is resolved, the ulcerated area in the cervix will be refilled and replenished with new cells through cell proliferation. And it is this cell proliferation that is diagnosed as a cervical cancer. An absolutely natural biological process. No reason to panic. On the contrary, in German New Medicine, we call all tumors that develop during the healing phase curative tumors, because it is an indication that the related conflict has been resolved, that the tissue is now in healing, and that the so-called cancer is of a healing nature. So just to give you a little bit of an overview, we have basically two groups of cancers. One group that develops during the conflict active phase, which are all tumors that are controlled from the old brain, and all these tumors serve a biological purpose. They have a biological significance in order to facilitate a conflict resolution on the organ level, as we have seen today with kidney cancer. Okay? And then there's another type or set of tumors that only occurs during the healing phase. In this case, it is a refilling and replenishing process. The tumor does not serve a biological purpose. It is part of the healing process of refilling the ulceration and the tissue loss that occurred during the conflict active phase. So curative and healing nature. Okay. We also see the difference. A person who has a tumor that is in the active phase is also stressed out, can't sleep, has the cold hands. While a tumor woman or a man who is in healing with a healing tumor, the person is very tired, fatigued, okay, can't get out of bed, and the pain included with healing, swelling, inflammation, infection. There are hardly any symptoms during the conflict active phase, because during the conflict active phase, as I like to say, we don't have time to be sick, quote unquote. We gotta resolve the conflict, eh? Do something about what took place. And the nervous system and the entire body is engaged in helping us to resolve this. And when the conflict is resolved, we go into healing, and now it's time to rest. Now it's time to heal. This is why we are tired during the healing phase, so we can support this on the organ level. And this is when the symptoms start. But now we know, and that's the good news, the vast majority of symptoms that we actually notice are already healing symptoms. So we go back to the cervix. So this refilling and replenishing process in the cervix lining occurs during phase A of healing. This is basically the most, let's say, potentially uncomfortable phase, because healing always occurs in a fluid environment, so where there will be swelling at the site, which can cause pain. Can also be bleeding at this time. Think of it as a construction site. Lots of action there. So these small capillaries, they break easily. So during that phase, there can also be a little bit of bleeding. Of course, there's discharge, because the remnants are going to be eliminated of that, of this reconstructing process. Well, then there is the so-called epileptoid crisis. This is basically the healing crisis. Basically, what happens during the healing crisis is that the body is all of a sudden, the entire organism is pushed back, put back into a conflict active state just for the time being. And the biological purpose of this stress push, of this reacting activation of the conflict, is to press the edema out. The edema that is part of this phase A of healing. An edema is basically a water pocket that protects the area while it's healing. And at the height of the healing phase, this edema has reached its maximum size, and poof, there is this stress push pressing the edema out. This is when we have the crisis. Also, a person urinate quite a bit at this time. But now, because of the edema having been pressed out, the swelling is down. And the person, the woman in this case, goes into the healing phase B, and this is when basically everything just goes back to normal, provided there is no conflict relapse. So let's talk about this for a little while. Because every conflict relapse, so the woman is in healing, and then there is a relapse, there is a trigger where she has again the conflict activity about the sexual conflict. Okay? So there is a relapse of the conflict. And as we understand, every relapse, or relapse is a good word, interrupts the healing phase and therefore prolongs the healing phase. So in German New Medicine, we pay particular attention to these triggers so that healing can finally be complete. So let's talk about pap tests. Well, a pap test can be positive both in the active phase or in the healing phase. All the pap test indicates is that there are changes in the lining of the cervix, in the tissue of the cervix. With GNM, we can stay completely calm because we know that these changes take place either in the conflict active phase because there's a tissue loss in the lining of the cervix, or in the healing phase when there is the replenishing process. So in any case, there is never a reason to panic. It's just a marker. Well, it's always good to be reminded that these biological conflicts are unexpected, was not ready for this, and very subjective. Remember what we learned with the introduction. It depends what our mind associates with that conflict situation. It depends on the biological assessment of the situation. Okay? So it is unexpected and subjective. So this is why not every woman who has a sexual conflict of one or the other way gets a cervical cancer. But if she has a cervical cancer, usually if she is diagnosed with the cancer, it's already in healing. It's already an indication that the sexual conflict has already been resolved, that there is a curative trauma that is in action there. Okay, and now we have to, in the therapeutic approach, now we have to start to look for the triggers. We know now it is a sexual conflict. Okay, so we're going to look, since when were you diagnosed? Well, 2-3 months ago. So we know, when did you start to have symptoms? Well, 3-4 months ago, this is when the woman went into healing. This is when the conflict was resolved. So she knows 100%, if we point the finger that this is a sexual conflict of rejection or a distress with sexuality, she knows exactly what we're talking about. Okay? So now we have to evaluate, is this still a natural time, so to speak, frame where healing takes place? Remember the sore knee, the man that had the accident? That takes a little while to heal, right? And as Voltaire, the French philosopher, so beautifully said, the secret of medicine is to distract the patient while nature heals itself. Right? And this is the same thing. So that knee needs time to heal. The cervix needs time to heal. So we have to look how long has this healing process been going on, so we can sort of evaluate, is still that the normal healing process in the time frame? Then distract yourself. She will know if the sexual conflict is completely resolved, and just enjoy life. However, if that cervical cancer is still there months and months later, now we're going to look for the triggers. What is still upsetting you? Where is the place and the woman, the other woman, and this and that still reminds you of that conflict? And this is where we have to start working on, try to neutralize, as I like to call it, these triggers so healing can be complete. My friends, there's lots of work involved. But now we have a key, because all these symptoms are no longer a mystery. We know what causes it, we know in what phase we are, and most of all, we don't have to be scared. Okay, this is beautiful. This is a brain scan that shows, again, I have another one coming up here, the phase B of a cervical cancer in healing. So if we look at the brain scan, we know that person is in the last phase here of healing of a cervical cancer. Okay? In previous CT scans, if she's active, she would see the target ring configuration in that area. Okay? But this is already the glia pocket, diagnosed by conventional medicine as a brain tumor. See what brain tumors are, okay? Every time there is healing during phase B, there are the glia pockets in the area of the brain that control the healing of the organ. If this is a tumor, if this is a skin rash, if this is a common cold, if this is a sore back, in that phase we see the glia pocket. Okay. But conventional medicine, they look either at the brain, they look at the body, they look at the psyche, but they don't see the whole picture. And most of all, it's the old medicine that thinks and believes that diseases are errors of nature, and they are not. Yeah, here I've compared again. Here's the kidney cancer in phase B in healing. Now we see the glia pockets. Okay, here we go. Well, medical science claims that cervical cancer is caused by strains of the so-called human papillomavirus, allegedly transmitted through sexual contact. In 2006, the FDA approved a vaccine against cervical cancer vaccine that presumably prevents cervical cancer. And shortly after, governments around the world mandated that girls should be offered the vaccine to prevent cancer. It should be offered to them before they become sexually active. This is how girls, young girls, between the age of 11 and 15, actually 9 and 15, became the target group of the vaccination industry. In spite of a CDC report that cervical cancer vaccines are linked to death, the FDA committee recommends boys and men to get the HPV vaccine. Well, men can obviously not get cervical cancer. But so the argument goes, if or when a boy or man performs oral sex on a female, he could contract the virus and thus be at risk of developing throat cancer. God help us. But it doesn't stop there. The HPV vaccine may also prevent breast cancer, so they claim. Vaccination nations. This takes us back to the presentation I gave last November about the truth about infectious diseases, but also I talked about the problem conventional medical science has, because the big question is, again, where is the scientific evidence of the HPV virus? The answer is, there is none. Or, in the words of Canadian biologist David Crowe, a closer look reveals that actually there is no proof. This quote was taken from the book Virus Mania by Thorsten Engelbrecht and Klaus Köhnlein. I introduced the book last time at the lecture here in Vancouver. And the authors of Virus Mania also demonstrate the following. As with HIV, hepatitis, SARS, polio, H5N1, H1N1, HPV has never been scientifically proven. Isolating one of these viruses in a purified form with its complete genetic material and virus shell directly from it and then imaging it with an electron microscope has never taken place. Mike Adams editor of Natural News, wrote on October 8, 2009, so just a few months ago. The mere presence of a specific microorganism in a specific organ or specimen does not mean to say it is the cause of the cancer. In most viral studies, the antibiotics are demonstrated, but not the virus itself. Again, let us not fall for this type of science. I fully agree, and that's why we go back to German medicine. And the prostate. We look first at the organ. The prostate is a gland that produces seminal fluid. It is the male organ that secures procreation. And this is why the prostate derives from the oldest germ layer, which is the endoderm, and is controlled from the oldest part of the brain, which is the brainstem. A protein that is a component of seminal fluid is commonly referred to as PSA, or prostate-specific antigen. Well, the conflict linked to the prostate is, according to its function, a procreation conflict. So in nature, such a conflict occurs if a male is not being able to mate. Remember, when a female is not able to mate, the cervix lining ulcerates, causing tissue loss. So when mating takes place, more sperm can reach the uterus to enhance the chance of conception. So if a male cannot mate, the prostate tissue, the prostate cells start to proliferate. And the biological purpose of the cell proliferation is to produce more seminal fluid. So when mating occurs, there is a higher chance of impregnating the female. In the human world, a man can suffer a procreation conflict if he's not able to have children, if he cannot have children. Or, so Dr. Hammer found, also when his children cannot produce any offspring. So this correlation, this innate correlation between the prostate and the procreation conflict shows that a man's concern about not having children or grandchildren is also a biological concern. Like with females, a male can suffer a sexual mating conflict experienced as sexual rejection, sexual frustration, being sexually turned down or unwanted. So such a conflict can experienced by a man when his wife or his girlfriend leaves him, particularly when she leaves him for another man. Or the suspicion that she is sexually attracted to another man can already trigger the conflict. But this is now very interesting. Dr. Hammer found that the prostate is also linked to what we call a gender conflict. A gender conflict has nothing to do, or it's nothing to do with a man's sexuality. A gender conflict is about maleness itself. It's about being disregarded as a man, disregarded as a husband, as the father of the children, as the provider of the family. So ugly divorces, custody battles, emotional and financial abuse can trigger that conflict. So what happens? The moment the conflict occurs, the conflict impacts in the area of the brain that controls the prostate, and the program is switched on. And at this point, the prostate cells start to proliferate. And parallel to the cell proliferation, the PSA level naturally rises. Conventional medicine uses PSA as a tumor marker. But with German New Medicine we know there's nothing abnormal with an elevated PSA level. All it indicates is that the man is conflict active with a prostate-related conflict. So an absolutely normal event. Nothing is abnormal with an elevated PSA level. If the conflict lasts over a longer period of time, then the cell proliferation forms a prostate tumor or prostate cancer. While during the conflict active phase, there's usually no symptom. So most prostate cancers are in fact found during routine checkups. So it is the increasing pressure of testing or for testing why prostate cancer is the most dominant or frequent cancer in males. In fact, this increasing pressure for testing for men and for women is the reason why cancer, or the numbers of cancer, increased so drastically over the last few decades. So not much to notice here. The PSA level is up, so when a man goes for checking or screening, okay, he has a high PSA level, then it says we got to keep an eye on it and so forth. Okay? Now we know why it's up, and the man knows he's active with such a conflict. As soon as the conflict is resolved, healing sets in. Now we are seeing symptoms. Well, if the tubercular bacteria or fungi are available, the microbes will now start to decompose the tumor. That produces tubercular secretion, which is eliminated through the urine, and this is why the urine is cloudy. There might also be blood in the urine because, as I explained, these small capillaries, they break easily. So there is discharge in the urine, there is blood in the urine, there is always swelling because healing always occurs in a fluid environment. So there will be swelling there. With a large tumor that has to be decomposed, there's even, of course, more swelling during phase A, such a tumor can compress the urethra, resulting in a delayed urine flow. Dr. Hammer recommends in acute cases a catheter, temporary catheter, until the healing is complete. During the healing phase, there are also night sweats. This is when tubercular bacteria in the picture. See, and this is when a man starts to see a doctor if he doesn't go for checkups. He's tired, he has discharge and blood in the urine, the swelling and the pain, and this is then when the diagnosis sets in. We know this is in healing. With the night sweats and all these symptoms, okay, always, gentlemen, watch the protein loss. So it is very important to supplement the protein loss during the healing phase. If the man doesn't have the TB bacteria, the tumor stays in place, okay? But the PSA level goes back to normal, because the tumor doesn't serve a biological function. No need. The conflict is resolved, so the tumor stays and encapsulates. Prostatitis, it's an inflammation of the prostate, inflammation, healing phase, hot phase, warm phase, typically for healing. So it's an inflammation. It's all a question how it's diagnosed. Okay? Together with healing, the PSA level goes back to normal, provided, okay, you know what this line means, provided there is no conflict relapse. So with the conflict relapse, we see again conflict active with the sexual rejection and the conflict that I mentioned, the PSA level goes parallel, up and down, okay? But in any case, the PSA level is no reason to panic whatsoever. So what about benign prostate hyperplasia? It's all just names. Okay, in German New Medicine, the differentiation between benign and malignant is pointless, because there is no such thing as malignancy. It's all serves a purpose. Nature doesn't make mistakes. So what is the benign prostate hyperplasia? Well, we have to realize or know that conventional medicine differentiates between two types of PSA. To make this simple, or put this simple, there is the bound PSA and the free PSA. And when there is an elevated bound PSA level, this is considered in conventional medical terms to be a prostate cancer, or indicates a prostate cancer. If the free PSA is up, then it's either prostatitis or it is benign prostate hyperplasia. Just labels, nothing to worry about. Okay? So, but how reliable is PSA testing? Well, according to the BBC News, not very much. PSA test of little value. This is from a website of BBC News, February 6, 2006. Let's read this together. A screening test which can reveal prostate cancer is too unreliable to be recommended to patients, it is claimed. A UK expert writing in the British Medical Journal, a renowned journal, says it should not be widely used as it is not clear whether it actually benefits patients. Professor Malcolm Law from the Wolfson Institute of Preventive Medicine in London wrote in the British Medical Journal that public health authorities should not advocate tests of unproven value. He said, at present the only certainty about PSA testing is that it causes harm. Some men will receive treatment that is unnecessary, and the treatment will cause incontinence, impotence, and other complications. Well, look at that. According to an article in the British Medical Journal of 2003, PSA tests fail 92% of time. Well, it gets even more interesting than that. Because a man can have an elevated PSA level even if he doesn't have prostate cancer. He can also have an elevated PSA level even when his prostate has been removed. And on top of it, women can also have an elevated PSA level. As it is published in the New England Journal of Medicine, a very renowned medical journal, PSA levels in a woman with metastatic breast cancer. So how is this possible? It is possible because PSA is not only present in the prostate, it is also present in other tissues like the breast. It has also been found in the liver and in the salivary glands, for example. That means that there is nothing specific about the prostate-specific antigen. There it goes. So what is an antigen? Well, an antigen is by definition any substance that stimulates the immune system. Well, no immune system, no antigens. Life is good with GNM. We're not finished. Okay, now we're going to go serious again. There was a little bit of a breeze. Okay, we're going to start now. I'm going to explain to you the so-called kidney collecting tubule syndrome. According to Dr. Hammer, his most important discovery. And you will soon understand why. The kidney collecting tubule syndrome involves two biological programs. First, there is an active existence, abandonment, or refugee conflict with water retention. So there's the conflict active phase of an existence, abandonment, or refugee conflict with water retention. And at the same time, there is a healing phase, in other words, a healing of any organ. For example, the healing of a breast cancer, that's why I have the picture here. This is an introductal breast cancer in healing. We see the inflammation and the swelling. Well, an existence conflict is often caused by the fear associated with the disease, by the fear of cancer, the fear of the treatment, the fear of the operation, the fear of having to go to the hospital. And this is why we call in German medicine the conflict linked to the kidney tubules also a hospitalization conflict. Because it is when people are hospitalized that the water retention often increases. Even more so when they are in intensive care. Because the water retention increases proportionally to the conflict activity. Hospitalization itself can cause or can create situations that cause abandonment conflicts. Hey, when the doctor doesn't have time for the patient, when the patient doesn't feel cared for, if there are no visitors. So if we have a loved one ever in intensive care or in the hospital, stay with them as much as you can. Take shifts. Make sure there's always somebody there from the pack. That can save a life. Because water retention can cause serious complications if an organ is in healing at the time. Because water is exceedingly stored in the area that is in healing. Particularly during phase A, where there is already an edema and water pockets, so to speak, at the site. So let's see what this implies. This translates into the following, and we're going to just a few points what happens on the organ level. With water retention, every tumor that is in healing becomes larger because there's water stored in the healing tumor. This is often then diagnosed as a fast-growing tumor or as an aggressive tumor, leading to more aggressive treatment, more fear, more water retention, a vicious cycle. Because of the water retention and the swelling, the pain increases, leading to increased pain medication, such as morphine and morphine derivatives, another part of the puzzle, while people often don't survive. Cysts may burst. So if there's a cyst in the healing phase, which I explain in a different lecture, another lecture, such a cyst is filled with even more water and the cyst can burst, causing complications. Ducts may occlude. So if there is a healing in a duct, a tumor in a duct, let's say in the bile ducts of the liver, this with water retention, this might occlude the bile ducts, causing serious complications potentially. The same applies to colon cancer. So if there's a colon tumor in healing and there's water retention, this colon tumor all of a sudden becomes large and can obstruct the intestines. With water retention, bronchitis turns into pneumonia. And so on. I just make a few points. So here we see a picture. This is a liver cancer with water retention. See how big that is. With water retention, water is also exceedingly stored in the brain edema that is always present in the brain, obviously, parallel to the healing on the corresponding organ. So with water retention, such a brain edema can become so large and can cause such brain pressure that the person falls into a coma and dies. The epicrisis, which is the stress push that pushes and presses the edema out, can become critical with water retention because the pressure, the brain pressure is just too big. So epicrisis is that a person would normally survive, let's say a heart attack, for example, might be fatal if there is water retention. Brain tumors, you know now what we mean with that. Brain tumor, a so-called brain tumor, the glia pockets is the part 2 of phase B of healing, always at the site in the brain, parallel to the healing on the organ level. So such a brain tumor with water retention again can become larger because water is stored in between the glia cells. This takes us to the question of medication, particularly of cortisone. Cortisone is a steroid. It is a stimulant. It has strong sympathicotonic properties. What does that mean? If it has strong sympathicotonic properties, cortisone increases the water retention, which means it increases the swelling on the organ in the brain and so forth. So cortisone can worsen the situation dramatically. Now we're going to open an entirely new chapter of German New Medicine and Dr. Hammer's amazing work. And this is very exciting. Dr. Hammer found that the 5 biological laws not only apply to physical diseases, but also to mood disorders like depression, or mental disorders, or so-called bipolar disorders. In other words, he found that mood disorders and mental disorders are also linked to biological conflicts, which means they have a brain correlate and they have an organ correlate. They have a conflict active phase and they have a healing phase. And most of all, the 5th biological law also applies, which is every disease, quote unquote, is a biological special program of nature created to support an organism during unexpected distress. And I'm going to give you a taste of this amazing work. Dr. Hammer found that a mental disorder, or rather a mental imbalance, only occurs if the person is in a so-called schizophrenic constellation. The word schizophrenic implies that both brain hemispheres are involved. Or to be more precise, a person is in constellation, as we say in GNM. So a person is in constellation if the person is conflict active with 2 or more conflicts that involve the right and left side of the brain. And it is the combination or constellation, just in the zodiac, or constellation of conflicts that determine the changes on the mental level. So it is the combination and the constellation of the conflicts that determines if a person is hearing voices, is paranoid, has certain obsessive compulsions, is aggressive, or shows an autistic behavior and other so-called psychotic symptoms. And depending on the degree of the conflicts involved, this mental imbalance can range from mood disorders to a severe manic depressive state and a severe mental illness. So quickly, just in a few words, how does a person get out of this? Lots of work. But we concentrate and focus on the recent conflicts. Okay, there's lots more information I can't tie in right now. We focus on the latest and recent conflicts. But the point is, as soon as, watch the slide, as soon as one brain hemisphere is conflict-free, the person is no longer in constellation, and the behavior and the condition can go back to normal. As I said, lots of work involved both for the client and the GNM practitioner. But now, this is the first time that we have a key to open and unlock that door. And now I'm going to introduce you to two constellations. First, the kidney collecting tubal constellation. Here we have a brain scan. And you see here the two sharp ring configurations, a classic, beautiful tubal constellation. Here again, the one above, healing of a kidney cancer, clear pocket. Okay, this is active. So we have learned that the kidney tubals are linked to abandonment conflicts, existence conflict, refugee conflicts, hospitalization conflict. Just think fish out of water. So the first conflict impacts of these kind impacts randomly right or left. So the first conflict goes, in this case, to the left kidney, controlled from the left side. As soon as the second conflict impacts on the left side, so involving the right side, the right kidney, the person is in constellation. And this kidney collecting tubal constellation manifests itself as disorientation. So the person who has with a small kidney collecting tubal constellation has a poor sense of direction. These people get easily lost in unfamiliar places. In fact, or more precise, there is this fear of getting lost. There is this anxiety of getting lost. People in this constellation, they just love to stay at home or close to home. When they go out, they usually go to the same restaurant, they go to the same pub, they walk the same routes, they sit at the same bench. They just like to be in their surrounding. People in this constellation, they feel not comfortable with traveling, particularly not with traveling on their own. So when they have to travel for personal or professional reasons, they are at the airport hours before departure. And they also go straight to the gate. And they're not going to shop around and explore the stores. They stick close to the counter so they don't miss boarding or, God forbid, a gate change. But why this behavior? Why this compulsion? Well, we are back to the fish out of water. The compulsion to stay as close to home as possible relates back to the original conflict of being swept out of the water and thrust on shore. But by staying put, this is the chance to be picked up by the next wave and to be carried back home, so to speak. And we know this behavior from people who are lost in the desert. What do? They go in circles, right? They stay in the area because this is their only chance to be found and rescued. If that tubal constellation is more intense, a person can be so disoriented that the person no longer knows where he or she is. And this is what we find in psychiatric clinics. This is what we find in nursing homes, in hospitals. And this is what we find in people with Alzheimer's who wander around totally disoriented, feeling like a fish out of water in that home. with this constellation, there is also a sense of being figuratively lost, confused. So confused people typically stare into space. They have this vacant look. They are incapable of any reflections. They are absent and apathetic. But there is also a loss of sense of time. To be more precise, there is a loss of sense of the present time. But this loss of the sense of the present time is substituted with delusions of being somewhere else or of living in an earlier period of one's life. And this is exactly the biological purpose. This is the purpose of the constellation, because the constellation allows us to go for the time being into an imaginary sanctuary, into a place where we are not alone. And this is, my friends, how nature takes care of us when needed. It's hard to get not excited. So let's go to the last part here, which is another constellation, the so-called sensory or post-sensory cortex constellation. Easy. This is the sensory cortex, post-sensory cortex, and the central area, this area here, is linked to separation conflicts. Separation from a loved one, from a partner, a spouse, a friend, a parent. The fear of such a separation can already trigger the conflict. And as soon as there are more than two or three conflicts, if there's a constellation, so right and left conflict activity, we're seeing changes. And this constellation manifests itself as short-term memory loss, of being forgetful. And this is the purpose of the constellation. The constellation allows us to forget until we are in a better position or better able to cope with the distress of the separation. It is a form, a beautiful form of protection, because in nature, a separation from an offspring, a mate, or the pack is most dramatic. So we see this behavior also in cats, because we know that from observation and studies, if kittens are taken away from the mother cat and are given back to her, she first doesn't recognize them. This is how we see this instinctive behavior. Well, if children are forgetful and have difficulties concentrating, this is called ADD, or attention deficit disorder. Dr. Hammer's research makes it very clear and leaves no doubt that children who have difficulties concentrating, who forget doing their homework, and as a result it causes learning difficulties, that they are conflict active with separation conflicts. Often this condition starts when they're separated from a parent. I don't have to say more. So what is ADHD? Oh, these letters. H stands for hyperactivity. And Dr. Hammer found what is hyperactivity? Is being restless, not being able to sit still, having this urge to move. Dr. Hammer found that this behavior is linked to a motor cortex constellation and the conflicts of feeling stuck involving the muscles. But in case of a constellation, the child counteracts the distress with maximum movement, constant urge to move, not being able to sit still. Okay, fidgeting at the dinner table. Move, move, move. There's nothing wrong with these children. From now on, when we hear ADHD, we should not think of a disorder. We should think of separation and feeling stuck. And the stories open up right in front of us. And this is our invitation to make changes for the sake of our children. Memory loss is also a symptom of Alzheimer's. While in this age group, it is often the loss or separation of a spouse. Look how beautiful they are. Look at them. Of a long-term friend, of a partner, causing the separation conflicts. And if such an elderly person is put in a senior's home or even a nursing home, we can just imagine that more conflicts of this nature are added to the situation. And if this conflict activity goes over years and years and years, this is what causes dementia. Conventional medicine considers Alzheimer's a degenerative disease. The truth is, there is nothing degenerative in people with Alzheimer's. It is our society that has been degenerating way too long. In societies and cultures where the grandparent generation is still part of the family, where they feel needed, where they play an important role in the upbringing of the grandchildren, ADD, ADHD, Alzheimer's is unheard of, because there's always somebody at home. This is the secret. So German New Medicine, Dr. Hamer's New Medicine, our new medicine, is about connecting. It's about reconnecting. It's about communicating. It's about getting along, about being there for each other, rejoicing in each other's company. It is about togetherness, and it is about oneness. And today, I would like to close my presentation with a poem. A poem composed by a spirit. It was sent to me during the time when I was preparing for today's talk about healing rejection and abandonment. And this is the message. You will never be abandoned or left alone when you travel with love. That is your true companion. This is your lover, your friend, your father, your mother. Your true companion is love itself. It lives within you. And when you're not afraid, this love comes to the surface of your being and it moves out. And the world sees it. And the world loves to be with you. May love always travel with us.